your favorite Canadian IMG.
Hi subscribers, hi friends, hi viewers, Happy New Year. Welcome back to the 2022 maiden episode of IMG Chronicles. If this is your very first time here, you're very welcome. My name is Dr. Shay, fondly called, and I am the face behind IMG Chronicles. IMG Chronicles stands for International Medical Graduate, chronicling our journey. So I started by sharing mine. We've shared many others on this platform, and as a lot of us already know, this is aimed at promoting wellness amongst us, encouraging you with our successes, sharing our failures for you to learn from, and sharing lessons learned along the way. And that's why I do this. So first, I will start by welcoming you all to the year 2022. I pray it is a year where dreams are realized. I hope it is a year that gives birth to promises and things hoped for. I hope this is the year you get to practice medicine as a physician in this beautiful country. And if you're still outside the shores of this country and you're working on getting your papers to come in, I hope this is the year that happens for you. And if you have been trying before now, I hope this is the year of success. And remember, success is not just one way. Success can come in the form of various journeys leading to that final destination of practicing medicine in Canada. So again, welcome back. And to all those of you new subscribers, welcome to this space. You are in a safe and good space, I can guarantee you. Pardon my voice. It's been a rough start to this year for myself and for my family. I hope this is audible to all of you. 2022 did not start well for us, but I know that that is not the course of the rest of the year. It was just a rough patch, and we are certainly winning. I will share two personal things that I've dealt with in this very young new year. I'm sharing it because it relates to life. The goal for this channel is just one of those things that we would do as humans, right? A career. But we've got family and we've got other aspects that makes us part of the whole being that we are. So I'm going to share two personal things that I've dealt with. The first one is I lost a very dear and young cousin on the 2nd of January to complications of diabetes mellitus. It's really sad that in 2022 people die as a result of DM. It shouldn't be acceptable, but where there's still a lot of ignorance and us not checking ourselves or taking things for granted, it can happen. So in his case, he was previously undiagnosed with DM. despite a very strong family history in my family. We've lost several family members, including the late boy's father, who also died at a young age due to complications of DM. So this especially hit home really hard. You know, he had DKA complicated by a fungal rhinosinusitis, and he died. As if that was not enough, half of my family, including myself, tested positive for COVID on the 3rd of January, and we have been dealing with that. Today is the first day I am out of my bed and back to somewhat normal again. This I attribute to the vaccines. So I was fully vaccinated, or I am fully vaccinated with my booster. Thankfully my kids are, my husband is, but one of the kids still got sick with COVID. But what I can say as someone who's been treating COVID patients is the virulence is definitely much less. I was really sick for about 3 days. No respiratory difficulties. I had the symptoms of, I started with a mild sore throat, and just due to the high index of suspicion, you know, with Omicron, and I had recently gone out of my province, you know, so I had a high index of suspicion, and that rapidly became chills, fever, intense myalgia. The myalgia was so bad, it's still so bad. The cough started last, you know, but I've made very good recovery. My son is also recovering well. So why am I sharing this? I'm sharing this for us to be more aware, for us to take more responsibility for our health and the health of those close to us, those around us who are close, who are family, who are friends. I feel really pained about the death of my young cousin because I never did give him that basic diabetic education myself. Those signs to look out for, those symptoms to look out for, knowing that was what killed his dad and many other family members. So I carry that with me, you know, checking ourselves, because we've also got medical providers who do not do their routine medical checks, who do not do their annual checks, who take things for granted. Females like myself who haven't done a PAP in 5-10 years, you know. Men who are over 40 who've never had their A1C checked, or over 50 who've never had a fit screening. So please and please, I implore us all that 2022, let's take care of me first, of those close to us first, while we're taking care of other people, of patients. Let's practice what we're telling our patients. Let's practice what we're reading to tell our patients. So that's first lesson. And then the second lesson is with regards the COVID situation. If you are listening and you haven't gotten your vaccines yet, there is no excuse. Vaccines are not meant to cure the disease. Vaccines are meant to curtail it. They are meant to give you a milder form of the same disease. They are meant to prevent you from dying from preventable diseases. And we are seeing that with our response to the current Omicron wave. We are recovering. We are most likely going to get this infection, all of us at one point or the other. But our preparedness in fighting is what will make the difference. So don't end up in ICU, don't end up in hospital. I have recovered at home. I'm still recovering, but everything is at home. So please don't make yourself an unnecessary statistic. So that said, I will try to increase my energy level and inflect some positive energy into my voice for the rest of today's recording. This is meant to be a reflection of the year 2021 for IMG Chronicles and our plan going forward into 2022, what we hope for 2022 to birth. You know, I started this on Christmas Day of 2020. So it's just been a young 1 year. But so much has happened. So much growth and positivity has been shared in this 1 year. So many lives have been touched. And I think the motivating factor for me for starting this was in that journey, while I was walking through that journey, through that wilderness, there was a lot of depression. There were no resources available. That community was absent. I created the community I wanted and surrounded myself with it, but that is missing for many people. And I wanted to be able to give back in that regard. I wanted to be able to create a home, to create a safe haven, and IMG Chronicles has been doing just that. Weekly, I get emails, I get messages on Facebook, on Instagram, you know, of people asking questions from all over the world, from Ghana, from Uganda, from Australia, from Ireland, from Nigeria, from within Canada, asking several questions that I take my time to respond to and give meaningful, useful answers. And for those answers I do not have, I source for them and respond. So it's been a lot of hard work and dedication on my part, because remember, I'm no longer a resident. I'm working full-time. I'm an academic staff, amongst other things I'm involved in. So it's been a lot of dedication. You know, it's been a lot of doggedness. That is something I have sworn to do, and I continue to ask for grace to do this. I promised I will share a video every month, which when I look back at the year that happened, I was able to do that by the grace of God. You know, and successes, testimonies, trails. So I'll share a few things that happened in our community. At the time I got into residency in 2019, I matched into family medicine in my program alongside another Nigerian, and there was a pediatric slot at the University of Alberta which a Nigerian got into, and a Nigerian got into a slot of internal medicine in University of Alberta. And those were the only people that I knew in the country that year who were Nigerians who matched. Many may have, but those were the people I knew about. I knew about several who had interviews and nothing came out of it. It wasn't successful, you know. But this year, in 2020, there was no Nigerian taken into my program. You know, in 2021, 6 months after the running of IMG Chronicles, several months of interacting with some of these candidates, six Nigerians marched into various programs across the country. 6. One of them, who's shared her story here, marched into the dual program of family medicine and public health, which is usually only for Canadians, but this year that spot was not filled by a Canadian and it was offered to an IMG, and she clinched it. Opportunity met preparation. She was ready, her exams were done, all of her documents were intact, and she got called for an interview. Unexpected interview. It was the second iteration and she matched. That, if that is not a definition of success, of growth in our community, I don't know what is. That is just one of several. You know, I said in my intro that the goal of this channel or of this blog is to help you with integrating into the Canadian healthcare system. I did not mention residency as the only way. That is just one of the pathways. Remember, we started a Practice Ready assessment series last year, and we started with the province of Saskatchewan, right? We also talked about the UK as a plan B, getting a license from the UK and bringing it here to practice. So we've talked about several pathways on how it can happen, right? You know, so that was just sharing the success from residency. Now, in terms of Practice Ready, 3 of our very own got accepted in the province of Nova Scotia for Practice Ready assessment in this past year. Do I hear drum roll? 3. You know, 2 are still waiting on CIPA. They passed their therapeutic decision making exams, and then the next step is they're waiting for placement. One of them successfully completed her assessment period in CIPA this past December, and she started work. One of us. Lastly, some of our family members on IMG Chronicles who went to the UK for their residency, 2 are back in Canada with their Royal Fellowship to start practicing in Canada after 3 years of training in the UK. They're back home, reunited with their families. So many stories, so many stories, so many stories. And thank you to all of those colleagues who are helping in mentoring, who are helping to answer these questions that people have. Thank you for your support. I get a lot of notes saying, Shay, thank you for what you do. But the only thank you I really would like is touching the candle for the next person. Lending your hand and lifting another. Each of us, if we take up that responsibility, you can think of just how much brighter this space will shine. You know, lifting and encouraging each other. So whenever you have that opportunity, lend that hand. Support. That is what this community is about, and that is the only thank you I desire. So for 2022, I said it at the beginning that I look forward to more successes. I look forward to sharing more stories. I look forward to highlighting more testimonies, you know, and the Practice Ready series that I started last year, we continue this year. We will take all the provinces one after the other. And we also this year plan to expand even beyond physicians. I've asked a dentist to please lend her voice, which she's agreed to. She will tell us how it is to integrate as a dentist here. You know, physiotherapy is there, nursing is there. I've asked 2 nurses, one of them trained in Nigeria but practicing here, and the other actually trained here but she's a foreigner, right? You know, for them to share their experiences, hoping someone out there needs that. And as always, keep your questions coming. Closer to the CAMS interview this year, I will have a Q&A, maybe a 30-minute Q&A, just to answer questions and concerns or fears, address fears you may have regarding your interview if you got a slot for interview. So once again, welcome to 2022. Thank you to all of our new subscribers and welcome. This takes a lot of energy, a lot of my time. You know, when they say time is money, literally it is, because as a physician, as a family physician in Canada, we are fee for service. We are not salaried. You work, and the hours you work determine how you get paid, the number of patients you see. So for every time I sit down and I'm creating content and doing stuff here, you know, that is work that I'm not being paid and I'm losing out. So if you are communicating, respect that and please be polite. I cannot individually talk to people, but what I'm sharing publicly so that more than one person can get the benefit. Let it be beneficial for all, not for just one. So I encourage you to continue to share your questions publicly so that people can learn from the answers I provide. So I look forward to seeing more of us in this new year of 2022. May it be a healthy 2022. May we all remain safe. Don't forget to like. Don't forget to share. Don't forget to subscribe to IMG Chronicles. Have a most wonderful 2022.
Kindly subscribe. Don't just watch it and walk away. Many need this information from all over the world who are interested in coming to Canada to work as doctors. So kindly share, like, subscribe, follow us on all of our social handles.